The health risk of high visceral fat in men and women over 40. Visceral fat is a type of fat stored within the abdominal cavity and is also known as hidden fat, as it cannot be seen or felt. Unlike subcutaneous fat, which lies just beneath the skin and can be pinched, visceral fat releases hormones and chemicals that can increase the risk of developing serious health conditions, such as diabetes, heart disease, and stroke. In both men and women over 40 years old, high levels of visceral fat have been linked to a higher risk of developing health conditions such as insulin resistance, metabolic syndrome, and type 2 diabetes. Women are at a higher risk of developing visceral fat due to hormonal changes and a natural decrease in metabolic rate and muscle mass with age. Insulin resistance is a condition in which cells in the body become unresponsive to insulin, a hormone produced by the pancreas. Insulin plays a vital role in regulating blood sugar levels, as it helps the cells in the body absorb glucose from the bloodstream to be used as energy. When cells become resistant to insulin, they are unable to absorb glucose efficiently, which results in an accumulation of glucose in the blood. This is known as high blood sugar levels or hyperglycemia. Insulin resistance is often a precursor to type 2 diabetes, a chronic condition characterized by high blood sugar levels and a range of associated health complications. Insulin resistance can also increase the risk of developing other health conditions such as heart disease, stroke, and high blood pressure. One of the contributing factors to insulin resistance is excess body fat, particularly in the abdominal area. When fat cells in the body become overloaded, they release inflammatory substances that can reduce the body's sensitivity to insulin. Additionally, a sedentary lifestyle, poor diet, and genetics can all contribute to the development of insulin resistance. The symptoms of insulin resistance can be subtle in the early stages and may include feeling tired or lethargic, frequent urination, increased thirst, increased hunger, especially after eating, blurred vision, difficulty losing weight. If left untreated, insulin resistance can lead to type 2 diabetes, where symptoms can become more severe and may include fatigue, frequent infections, slow healing wounds, numbness or tingling in hands and feet. Treatment for insulin resistance focuses on lifestyle changes such as maintaining a healthy weight, regular exercise, and following a healthy, balanced diet that is low in processed foods and high in fiber. In some cases, medications such as metformin may be prescribed to help manage blood sugar levels. Overall, insulin resistance is a condition that can have serious health consequences if left untreated. By making lifestyle changes, improving dietary habits, and maintaining regular exercise, it's possible to manage and even reverse insulin resistance and reduce the risk of developing type 2 diabetes and associated health complications. Metabolic syndrome is a cluster of conditions that occur together, increasing the risk of heart disease, stroke, and type 2 diabetes. It is characterized by a combination of factors such as high blood sugar levels, excess body fat, high blood pressure, and abnormal cholesterol and triglyceride levels. The exact cause of metabolic syndrome is unknown, but lifestyle factors such as poor diet, lack of exercise, excess body weight, and genetics can all contribute to its development. Some of the risk factors associated with metabolic syndrome include heart disease. Metabolic syndrome increases the risk of developing cardiovascular disease, including heart attacks and strokes. Type 2 diabetes. The condition can lead to insulin resistance, which can eventually progress to type 2 diabetes. Kidney disease. Metabolic syndrome can cause damage to the kidneys, leading to kidney disease. Sleep apnea. Individuals with metabolic syndrome are at an increased risk of developing sleep apnea, a sleep disorder that affects breathing and can lead to other health complications. Non-alcoholic fatty liver disease. Metabolic syndrome can cause fat to build up in the liver, leading to the development of NAFLD. Treatment for metabolic syndrome typically involves lifestyle changes such as losing weight, regular exercise, maintaining a healthy diet, reducing alcohol consumption, and quitting smoking. Medications may also be prescribed to help control blood sugar, blood pressure, and cholesterol levels. Making lifestyle changes and managing any underlying health conditions can help reduce the risk of complications associated with metabolic syndrome. It's important to speak with a healthcare provider to develop a personalized treatment plan based on individual needs and risks. Type 2 diabetes is a chronic condition in which the body is unable to properly manage blood sugar levels. Unlike type 1 diabetes, which is caused by the body's inability to produce insulin, type 2 diabetes is caused by the body's resistance to insulin or an inability to produce enough insulin to effectively manage blood sugar levels. When blood sugar levels are consistently high, it can cause damage to blood vessels and nerves over time. This can lead to a range of health complications, including Cardiovascular disease. Individuals with type 2 diabetes are at an increased risk of developing heart disease and suffering from heart attacks or strokes. Kidney disease. High blood sugar levels can cause damage to the kidneys, leading to kidney disease or even kidney failure in some cases. Nerve damage. Elevated blood sugar levels can damage nerves throughout the body, leading to vision problems, neuropathy, and other related conditions. High blood sugar levels can damage the blood vessels in the eyes, leading to vision problems or even blindness over time. Foot damage. Elevated blood sugar levels can cause nerve damage in the feet, making it difficult to detect injuries and infections that may lead to complications such as ulcers or even amputations. Skin conditions. People with type 2 diabetes are at an increased risk of developing skin conditions such as bacterial and fungal infections, as well as slow wound healing. Treatment for type 2 diabetes typically involves lifestyle changes such as maintaining a healthy diet, regular exercise, and monitoring blood sugar levels. In some cases, medications such as insulin or oral medications may be prescribed to help manage blood sugar levels. It's important to work closely with a healthcare provider to develop a personalized treatment plan based on individual needs and risks. With effective management and ongoing care, individuals with type 2 diabetes can reduce the risk of complications and lead a healthy, active life. It is therefore vital to prioritize reducing visceral fat for those over 40 to mitigate the risk of health complications. The best way to reduce visceral fat is through a combination of diet and exercise. Research shows that regular exercise, especially strength training exercises, can effectively reduce visceral fat. Consuming a diet high in fiber-rich foods such as fruits, vegetables, and whole grains can also help reduce visceral fat levels. By making lifestyle changes aimed at reducing visceral fat, individuals over 40 can lower their risk of developing health conditions and improve their overall well-being. The benefits of lowering visceral fat in a year or less. Lowering visceral fat levels can have significant benefits for individuals. Consistent weight loss and a reduction in visceral fat can lead to improved insulin sensitivity, reduced risk of cardiovascular disease, and improved mental and physical health. In addition to the overall health benefits, lowering visceral fat can also have cosmetic benefits. Excess visceral fat can create a protruding belly, and the reduction of visceral fat through weight loss can lead to a flatter, more toned abdomen. Making lifestyle changes through diet and exercise can lead to a reduction in visceral fat within a year or less. Consuming a well-balanced diet, rich in fiber and low in processed foods and added sugars, can aid in reducing visceral fat levels. Regular exercise, including strength training and cardio, can also be beneficial in reducing visceral fat. Visceral fat, or belly fat, is a type of fat that accumulates around the organs in the abdominal cavity. It is a serious health concern for both men and women over the age of 40, as it is associated with an increased risk of chronic diseases such as diabetes, heart disease, and certain cancers. Fortunately, there are several effective methods to reduce visceral fat quickly and easily. Exercise. Regular exercise is one of the most effective ways to reduce visceral fat. It has been shown to not only reduce the amount of visceral fat but also prevent it from returning. In a study of overweight women, those who exercised for 45 minutes per day, 5 days a week, reduced their visceral fat by 10% after 6 months. Exercise can include anything from walking to weightlifting, as long as it is done consistently and at a moderate intensity. Diet. A healthy diet is also essential for reducing visceral fat. A diet high in protein and low in carbohydrates has been shown to be particularly effective. In a study of obese men, those who followed a low-carbohydrate diet for 8 weeks lost significantly more visceral fat than those who followed a low-fat diet. Other foods that have been shown to reduce visceral fat include whole grains, fruits, vegetables, and healthy fats such as olive oil and nuts. Sleep. Getting enough sleep is important for overall health, but it is also essential for reducing visceral fat. Lack of sleep can lead to an increase in cortisol, a stress hormone that is associated with visceral fat accumulation. In a study of women, those who slept for 7 hours per night had less visceral fat than those who slept for only 5 hours per night. Stress management. Chronic stress has been shown to contribute to visceral fat accumulation. Practicing stress-reducing activities such as meditation, yoga, and deep breathing can help reduce cortisol levels and decrease visceral fat.